Hello everyone. So today I'm going to discuss a very simply commonly misunderstood topic, and that is how to calculate your fertile days. Let's start from the beginning, from the very basics. See, a normal menstrual cycle is of 28 days. Okay. So now suppose a patient has got her last menstrual period that we call as LMP. That is the first day of the periods. Suppose it is 1st June. Okay. And she knows that her next periods will come on 28 June because cycle is regular, right? So in this case, how do we calculate the fertile days? First of all, remember this circle is depicting a menstrual cycle. Okay, it can be broadly divided into two phases. That is the follicular phase, which is variable. Okay, please understand this word is very important. The follicular phase is variable, but the luteal phase will be fixed. Okay, the luteal phase is a fixed one. So what happens in follicular phase is that the eggs will start becoming bigger. The follicle will ultimately become bigger and mature. This follicle is having an egg. This egg will rupture on the 14th day of the cycle. Okay. Now this egg has a lifespan of 24 hours. But still we give one more day advantage to the patient, and that is why we will plus minus 2 days in this 14th of June. So 14th of June the egg will rupture, but plus minus 2 days. So her fertile days will be from 12th to 16th June. Okay, her cycle is of 28 days and the fertile days will be 12th to 16th June. Now very important thing to understand is that after the egg has ruptured, the remaining follicle is known as the corpus luteum. So follicle minus the egg after rupture is known as a corpus luteum. Now this structure is very important if the patient becomes pregnant. Also note that this corpus luteum has a fixed life of 14 days. The fixed life is of 14 days. Now what happens is, if there is no pregnancy, the pregnancy has not happened, then the corpus luteum will die after 14 days. It will die after 14 days, and hence the patient will get her periods next on the 28th June. Okay. But now what is the game here to understand is that luteal phase is fixed. Okay. So remember, these 14 days, the luteal phase, 14 days is always fixed for all patients. The follicular phase is the one which is variable. Okay. So how does it matter? I hope the next slide will help you to understand. Now this is about an irregular cycle. Okay. Now suppose for easy purpose I have taken a patient is having a 40-day cycle. Example. Okay. Again her LMP is on 1st June and she is saying roughly estimated the next cycle will be on 10th of July. Okay. Adding 40 days to 1st June, it will come as 10th of July. Alright. So now as I told, this follicular phase, okay, this follicular phase will be the one which is variable. Okay, it is variable. But we know that the luteal phase is fixed. It is of 14 days. Okay, it is a fixed cycle. So very simple, how do we calculate the rupture? From 10th July, you will subtract 14 days. From 10th July, we will subtract the 14 days. So the point is from the next day, from the next cycle, on the first day, okay, remember the first day of the next cycle, we have to subtract 14 days. So how do we do that? It's very simple. If you remove 10 days of July and 4 days of June, so rupture will happen on 27th June. Remember that, okay, because this cycle is fixed, this phase is fixed, luteal phase. Follicular phase can be anything, okay, depending upon the patient's cycle days. Now again giving advantage of 2 days because egg lifespan is fixed 24 hours, again giving 2 days advantage to the patient. So in this case the fertile days will be from 25th to 29th June. Okay, so please remember the whole idea is that from the next expected periods we have to subtract the 14 days. We never add 14 days to the first day. Or suppose a patient has come today 1st June, suppose, then we don't add it, but from the next expected periods I will subtract the 14 days. This is very important concept to understand, especially if the patient is having irregular cycles. Also note that this concept is required for both the patients who are trying to conceive or who don't want pregnancy. Of course, if they are trying to conceive, they must have intercourse during this fertile days. And those who don't want pregnancy must definitely use contraceptive during these fertile days. I hope these two slides were very clear. Thank you so much.